What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
Tacie, you're on Weird Medicine.
What?
You're on Weird Medicine.
You guys are still doing it?
Yeah, we're...
Oh, shit. I thought it was 4:15. I'm sorry.
Oh, boy. You got any topics for us?
I did have topics, but they're at home.
Okay. Well, okay. Well, thank you.
Okay, you're welcome.
Okay.
Call me later.
Okay, bye. Yeah, they're not drinking yet.
Obviously. How is a private eye like the dry cleaners? They both do other people's dirty work. How did the dad justify buying a boat? There was a sale. How did the meeting go between the cat and the couch? Cataclysmic.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott. Traditional Chinese medicine provider gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott. Uh-oh. Is your mic on?
Hey,
there,
Dr. Steve.
there you are. Hello, Dr. Scott.
Hello.
And we also have back from sabbatical, DNP Carissa. Hello, DNP Carissa.
Hello.
This is a show for people who never listen to a medical show on the radio or the internet. If you've got a question you're embarrassed to take to a regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DRScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. And please don't forget stuff.drsteve.com. Stuff.drsteve.com makes a huge difference in allowing us to keep the bandwidth and all that stuff for for the show. So shop at stuff.drsteve.com. Just click through to Amazon, and you can scroll down and see the Roadie robotic tuner.
There you go.
Or the Roadie coach, which will teach you how to play a damn instrument. It's incredible. So check that out at stuff.drsteve.com. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And try our Patreon, patreon.com/weirdmedicine. You get all kinds of archives of stuff that you can't get anymore and brand new shows that have never been heard anywhere else. And we did a live stream. I'm going to do another one. I'm going to start doing more live streams. I just got to get the balls to do it. I have the time. I just feel like, why would anybody want to watch that? And that may be true. Maybe nobody wants to, but we'll see. And then if you want me to say fluid to your mama for $5, go to my Cameo, cameo.com/weirdmedicine. I can charge more, and I've gotten more before. Not a whole lot more, but maybe 4 times that. It's not a lot. I mean, there's some people on there get $1,000 when they do one, but I just do it because I like it. So I'll say basically whatever, and go to cameo.com/weirdmedicine. If you want Myrtle to do it, you got to do a 24-hour one because that costs more. All right. Somebody wanted Myrtle to do it. They said that their wife hates it. And for Christmas, he wanted me to do it and do it a long time. So I put the wig on and the teeth and, how you doing? I hope you get you some good pills. It was terrible.
Love it.
Yeah. PA Lydia was here and she was dying because she'd never heard that.
Yep.
It just sort of happened. It's like, she's like, what is happening right now? Anyway, check that out. All right, don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And if you want to actually do something to help us out, if you go to youtube.com/@weirdmedicine, or just search for Weird Medicine on YouTube, and go to our playlist. There's a playlist of videos on there. Just go over there before you go to bed, click play all, and then turn down the sound and go to bed. And
yes,
we've got to get to 4,000 view hours. So one thing I want to do is some live stream stuff where we get on and we can do it with StreamYard and let people call in, they would just click on the link and they would be on the show with us.
Gotcha.
And I think it would be fun to do. And but for us to be able to do anything with that YouTube channel, we got to get 4,000 views. So,
gotcha.
All right, working on that. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And I guess I said that already. Tacie isn't here, so there will be no time of topics.
Oh, boo!
I know it's.
That means we're going to have to work harder. It's Tacie.
All right. That was really ham-handed. We got something in the mail.
Okay.
And it's pretty cool. And I've got one for each of you. It's from this company called Tennessee Hot Sauce Company. Sweet. And you all can send us stuff. tnhotsauceco.com. It's like Tennessee Hot Sauce Company, but it's tnhotsauceco.com. And this I have here is honey habanero. Apparently everything they have is fiery, really fiery.
Right on.
And they have suggested pairings and stuff. I thought that was cool that they sent that.
That looks great.
So check that out. Tell them old Doc Steve sent you.
There you go.
Maybe we can get them as a sponsor or something. But yeah, they were talking about doing a Weird Medicine themed hot sauce. I'll let you know if they do that.
Spicy.
Yeah, well, I told them it's got to be fermented because I'm all about fermented hot sauce, right? So I made that Tabasco sauce last year.
It was very good.
And I read how to make Tabasco sauce because I had 1 million Tabasco peppers. By the way, if you've never grown a Tabasco pepper, it's one of the most delightful plants you can plant because when those peppers come out, they're only about 1.5 inches long and they point up instead of down, and they're all different colors. They'll go from green to yellow to orange to red, depending on where they are, because they all mature at different rates, and it's beautiful. And but if you want to make actual Tabasco hot sauce, and I went to school with one of the McElhaney's, you have to ferment it. and you do it in a 3% brine, and which means you just, you take the water and you weigh it, and if it's 100 grams, you put 3 grams of water in it, or 3 grams of salt in it, and then you put it in this brine, and that will prevent bad things from growing, but it will promote the growth of the lactose fermenting bacteria that are on the surface.
Okay.
And so you don't have to add any cultures or anything. They're already there. They live on the peppers.
Okay.
And then they'll start to grow and then ferment. And then when it's done, you run it through a food mill, and then you measure the liquid that you've got. And if the liquid is, say, 1,000 milliliters, you would add 400 milliliters of apple cider vinegar to it. And then you're done. Now, I will pasteurize mine because I don't want bottles exploding in my... Because sometimes they'll still be fermenting, right?
Oh, geez.
The bacteria don't die when you put something through a food mill. They're so tiny, so they don't even know anything happened.
No.
So
probably just stirs them up.
Yeah, and they love an acidic environment and stuff. So I'll just put them in a pan that's got just under boiling water and let it just sit there for a little bit with the lid off, and you see a little foam come up to the top, and you cap them, and you're done. Just kills some bacteria in there. All right. Very good. So, yes, thank you, Tennessee Hot Sauce Company. Check them out. I have some news about psychedelic drugs. We've talked about this before. There is actually some FDA draft guidance, a little bit late, probably about 50 years late. I've always maintained, as much as I love Timothy Leary, I think he set back the research into psychedelic drugs by a mile. It wasn't just him, but the people who were proponents of bringing LSD and DMT and other drugs into the public sphere. And then you see all these people, hey, yo, man, I'm tripping balls. You see that. That's what people see, right? The politicians see that.
Oh, I know.
And they see Woodstock and a bunch of people rolling around, and, it's not mud, it's fecal matter. And, they're... with mud, but there was feces mixed in with that. But, you just see, and people go, oh, look at a bunch of dirty hell. I was one of those people. I was a dirty hippie. And the politicians were mostly not dirty hippies. And they're like, fuck this stuff. We're making it illegal, and you can't do research on it anymore. So when they made them Schedule I, that was it. That stifled research for the longest time. Well, now finally we can do a little bit of research on these drugs, and we know that, psilocybin is effective for PTSD. It's been studied in people who've been to war and have PTSD. Microdosing, there's data on that for depression, low dose. And then we've got ketamine. Ketamine isn't really a psychedelic, but it's in this. It's been used as a street drug for years. Special K.
Special K, yep.
But it will.
I like Special K.
I like Special K too. It will resolve major refractory depression sometimes in 3 days.
I know someone that did it.
Do you really? Can you talk about it? I mean, without doxing them, obviously. And can you get closer to the microphone when you tell us? Because I am interested in hearing this. I know somebody as well, so go ahead.
I don't know the details specifically, but I know someone that, quote, microdosed with psilocybin and had struggled with depression and mental health illness their entire life.
Yeah.
And after doing this,
they did ketamine or microdosing psilocybin?
Microdosing psilocybin.
Yeah.
And after doing so, it has a whole new outlook and mentation in regards to life, and is living a healthy, non-depressed life.
Yeah. Yeah, I know somebody that had refractory depression and tried everything.
Yeah.
And they were talking about doing electroconvulsive therapy, and they tried ketamine. And they didn't do the esketamine. Esketamine is Spravato. That's the drug that's on the market right now. It's about $1,400 a dose. It's a nasal spray. You do it, and then you give you have to keep the patient in your office for a couple hours because they're tripping balls when you do it a little bit. It is a dissociative drug, so you kind of feel like you're out of your body for a while. Some people do. And so you don't want people driving around if they're floating up above their body, you know. So you got to keep them in the...
Or seeing the streetlights drip.
Yes. Yeah. Yeah, what the hell was Dali doing?
That'd be weird.
He just was like that anyway.
Yeah, I think so.
And H.R. Giger, the guy that did the Alien. Have you ever seen his artwork? It's bizarre.
Yeah, I don't think so.
Yeah, it's crazy. Biomechanical stuff. So anyway, so these things can be effective. We could have had them 40 years ago if it weren't for the politicians saying, oh, we don't want a drug that these dirty hippies like. Obviously, it must be bad, which was ridiculous.
Right.
You know, one of the things I teach my residents is I ask them, after they've been in the hospital a little bit, if you have a drug seeker in the hospital, you may know the answer. Well, I know DNP Carissa will know this. What's their favorite combination of drugs in the hospital? DNP Carissa. She's not paying attention. That's okay. You were looking up something, I understand.
I would say a benzo and an opiate together.
Okay, well, that's
Actually,
close.
no.
That's close.
Yeah.
Okay, she knows what it is.
Do I?
Yeah.
I mean, I would say, do I want to be mean or good?
No, I'll just give the right answer.
Hydromorphone.
Oh, you could have said Dilaudid. It's fine. Yes. Okay.
Give thyself a bell.
Dilaudid and Phenergan. I knew what you were doing because I'm a bit of a stickler about using generic names on our service. But anyway, this one of my partners would call and say, "Well, this person's on Dilaudid," and I'll go, "What? I'm an asshole."
Never heard of it.
Yeah. Asshole.
Yeah, I don't know that word. And they go hydromorphone. But anyway, yes.
They being me.
Dilaudid and Phenergan. That they love it, but what they're teaching you something. They're teaching you that it's awesome. Okay, so you can learn something from anybody.
Sure.
And you have someone who is actively seeking drugs in the hospital, and they tell you they want Dilaudid and Phenergan. Then you know that it's amazing, and it is. So we can learn lots of things from people, and that's the problem. They could have learned something from these quote-unquote dirty hippies from the 60s, except they just decided to shut everything down because that's what we did back then. So if you were a little bit outside the box, that was the end of that. So we're finally coming around to this, and so there's a long way to go to get to this article. The FDA is publishing a draft guidance to outline the challenges inherent in designing psychedelic drug development programs and provide information on how to address these challenges. So these draft guidances are this is how you should construct your study. It covers classic psychedelics such as psilocybin and LSD that act on the brain's serotonin system, as well as enactogens and empathogens such as 3,4-methylene dioxymethamphetamine, which is MDMA. All right, that's a good one. MDMA is that's ecstasy, right? Am I wrong about that?
No, I think it is.
What is ecstasy? I always forget. Can somebody look that one up? I can't seem to get this up here.
Sure.
I wasn't paying attention again.
Oh my God! What were you looking up though?
I was messaging the person I know.
Yeah, it is.
That
Okay,
MDMA.
MDMA. It is MDMA. Okay, so there you go. So very interesting. Thankfully, the FDA takes forever, but they eventually come around to the right decision. They still haven't and people go, oh, well, COVID vaccine. Okay, they haven't approved it yet.
Right.
It's not approved. That's the thing. The FDA never approved that. It is authorized under emergency use, and now they're reevaluating that now that the emergency is over. So we'll see. And of course, as I must say, vaccines are effective and prevent the transmission of COVID-19, because if I don't say that, I get kicked off of YouTube. So there you go. I learned that from Jimmy Dore. Thank you, Jimmy. Yes. All right, that's number one. Number two, this isn't okay, speaking of COVID-19, which we're trying to get away from, but this is interesting. Selective serotonin reuptake inhibitors. These are SSRI antidepressants like Paxil, Zoloft, Prozac, are particularly effective in blocking COVID-19 transmission. Who would have known?
Not me, because I'd taken SSRI and had COVID 3 times.
Yeah, well, yeah. Research showed that 27.7% of COVID-negative patients had taken at least one antidepressant. That's not within the last 90 days before they were admitted to a mental health care facility, compared to just over 16% of COVID-19 positive patients. So that's kind of a backwards way of determining this. But so this was a correlation, not a causation kind of thing. But they did look at, a prescription for SSRI had almost 40% reduction in the likelihood of a positive COVID-19 test.
Oh.
So, yeah, you can still get it.
I was just wondering if maybe if you took SSRI, would you not give it to other people then if you had COVID?
I don't know. They didn't study for that. Yeah, they didn't study that. They didn't really study anything. This is what we need is a prospective trial. What they did was go back and probably everybody that was admitted to the psychiatric ward got a COVID test. And then they went back and had historical data and said, well, okay, how many of them were taking SSRI that had a positive COVID test and how many didn't? And it just worked out that the people that were on SSRI had lower incidence of COVID-19 when they were admitted to the psychiatric hospital. So this is one of those things that just gives you a signal. You can't act on this.
Right.
But there's a signal there in the data that says there might be something there. So now what you have to do is a prospective placebo-controlled trial, simply looking at whether you can block this virus. Well, hell, I mean, it's still out there.
Oh, yeah.
People are still getting it. So you still could do it, but you kind of missed the boat. I mean, for God's sake, it is now 2023. This would have been nice to know in 2020 when all this shit was going down. And people were laughing at people saying, oh, we should be pulling off-the-shelf drugs and seeing if they work, because we already have them. They're already on the market. Why wouldn't we do that?
Right.
But people were just shitting on people for doing that. And it was very disheartening. I still contend that therapeutics would have ended this thing a lot faster than the vaccine did. And for example, if favipiravir, which just disappeared off the radar, I think it's because Fuji isn't one of the big players in the United States. I'm not a conspiracy theorist, but it's interesting that molnupiravir, which is its first cousin, shows up in the United States, but favipiravir, which was already on the market, did not. But anyway, yeah, it's already been through phase 4 testing, everything for influenza, not for this. But if we had had a therapeutic like, say, Paxlovid, which reduces hospitalization by 90% in people that are at high risk for hospitalization. If we'd had that in the beginning, you get COVID, you go to your doctor, you get a prescription, and then you take it to the pharmacy if you're at high risk, and you take it, you don't die, you don't go to the hospital. It was over. That would have been the end of it.
But,
in 2020.
Yeah.
I was pushing that. Okay, so we shut down in April. By June, if you go back to the sit reps that I did back then, I was talking about favipiravir in June and saying then, this way before the vaccine was a twinkle in anybody's eye, if we have a therapeutic that works, this thing's over. But the billions and billions of dollars were put into this vaccine idea, which I get it. Listen, I'm not anti-vaccine. Fuck that. I grew up during polio, rabies, measles. I've said this on the show. One of my friends in kindergarten died from measles. We had a whole room of kids that were in wheelchairs in my school from polio. So we don't see that anymore because vaccines are awesome. But I was this kind of virus, where, we could have therapeutics to it.
Mm-hmm.
We don't really have a therapeutic for measles.
Right.
We don't have a pill that you can take for polio.
No.
But these sort of endemic viruses are a little different. Mm-hmm. And, we have a pill for influenza. It works pretty good. I think it kept me out of the hospital when I had it. And, we could have had this, and it would have been over. That would have been it.
Mm.
So that's the right way to go about dealing with a virus that has the potential of becoming endemic.
Right. Hopefully they'll remember that moving forward.
Well, hopefully we've learned our effing lesson from this. That if we had, listen, you can make mistakes as long as you learn from them.
Yep.
But anyway, so
yes.
Sorry, favipiravir, on what happened to you. Anyway, all right. And I've got one more here. Any other comments from you guys on any of this? I'm just monologuing. It's okay.
You're just riffing, man. You're just riffing.
Okay, I wish right. I wish G-Back were still here, because this is the one that would get us in so much trouble.
Oh, good.
He always would love that. You didn't know him, DNP Carissa. If you did know him, you would be making love to him right now. That's what a magnetic personality he had, and that's him up there on the playing the guitar.
Yeah,
he was just a beautiful guy.
Yeah.
You say that about people, I can't even explain it. I cried more when he died than anybody else in my family anytime. So I can't quite, I don't quite understand it, but he was just a beautiful guy. Mm-hmm. Anyway, one of the things that he liked to do was get me in trouble with these people called the intactivists. And intactivists are activists that are opposed to circumcision. I always made, I tried to disarm them by saying, listen, my argument is you're doing something that's basically cosmetic without the kid's consent. I agree with that. And they come after me anyway, because somebody on Twitter asked me, what's the American Academy of Pediatrics position on circumcision? So I just went to the American Academy of Pediatrics website, found their white paper on circumcision, and posted the link. And that's where it started. It went on for weeks.
All downhill from there. Huh?
Oh, yeah. Yeah. So, and so anyway, so I approached this with some trepidation. Let's
hear it.
Male circumcision may protect against HPV infection in males and females. This was a systematic review and meta-analysis published in Clinical Microbiology and Infection, not just a rag. This is a real journal. Highlighted the protective effect of male circumcision on the prevalence, incidence, and clearance of human papillomavirus. A lot of people don't realize that if you get HPV, your body can get rid of it. I used to have HPV on my feet. When it invades the feet, it makes these little keratotic, it's kind of a plastic that the body can make, these keratotic wells that hurt when you walk on them, to protect itself. Mm-hmm. And if you dig them out the right way by a podiatrist, sometimes the immune system will wake up to them and they'll go in and kill them. I don't have plantar warts on my feet anymore.
Right.
So my body cleared the HPV. It can do that. And teaching the body to clear it, there are, if you have genital warts, there are some immunologic approaches that you can take to get rid of them. But anyway, HPV. I'm sorry, go ahead.
No, it's fine.
What were you going to say?
I am curious if the whole reason circumcision may help prevent this is because of lack of cleaning. I mean, like the virus, HPV, would
just
multiply
hang around longer
and sit there because of the foreskin.
Yeah, so that's DNP Carissa saying that people with foreskins are nasty. That was not me.
Dirty Carissa.
Not me at all.
Dirty deep.
I did not say anyone was dirty.
Yes, you implied.
I completely disagree with your position on that.
Wrong, actually, wrong.
All right. Well, let's see what they said. So it's the most commonly sexually transmitted infection. Low HPV types are associated with genital warts. The high-risk HPV types are considered major causative factors for cervical cancer, penile cancer, rectal cancer, and head and neck cancer.
Yuck.
Yeah. So it sucks. So, this article starts off saying male circumcision is known to have protective effects. They're saying it, not me, against many sexually transmitted infections and sexually related conditions. So what they did was they did a systematic review where you take a whole bunch of studies and mush the data together and then see if you can get a statistically significant answer out on the other end. And they looked at the association between male circumcision and the risk of HPV infection in males and their female sexual partners. And so the study design was this. They looked at various scientific documentation databases and included observation and experimental studies reporting the effect of male circumcision on the prevalence, incidence, and clearance of HPV. Okay, so this they studied. They didn't study people; they studied studies. And so there were 1,400 studies, and 32 of those, including 25 unique study populations, were included in the systematic review and meta-analysis. So what that means is there were a bunch of studies that popped up when they put in HPV and foreskin or HPV and circumcision, but only 32 of them actually had any data that looked at the prevalence and incidence and stuff like that. So they... the prevalence of HPV infection among all participants at baseline ranged from 8 to 70%, and 21 studies reported the association between circumcision and HPV infection prevalence in males. According to the study estimates, circumcision significantly reduced the risk of HPV infections at both glans and shaft. The glans being the Roman war helmet. The highest protective effect of circumcision was observed at the Roman war helmet. And then they say irrespective, not a word, God, of the viral types, low risk and high risk HPV types. So anyway, in these studies, circumcision significantly increased both the rate and risk of HPV infection clearance at the glands. That's interesting. Then they looked at females, and there were a non-significant trend reported for prevalent infections and the incidence rate of low HPV infections. So, but it significantly reduced the risk of prevalent high-risk HPV infections. That's like HPV 16. That's one of the strains that causes cancer.
Right.
So anyway, they concluded that circumcision protects female partners of circumcised males, and that male circumcision has a significant protective effect against the prevalence, incidence, and clearance of HPV. So now, what do you do with this if you're a parent? Again, you are doing what we always said was if it doesn't save lives, then it's cosmetic. Mm-hmm. If you can show that it saves lives, then it becomes more than just a cosmetic thing that you're doing. Okay. So we do lots of things to kids. We make them wear seatbelts. We
brush your teeth.
Make them brush their teeth. Yeah. And we also make them take vaccines and medications and stuff like that they can't consent to. This does change their the sensation in the end of their penis forever. And some people think that it means that they can actually go longer, but other people say that it reduces their sensitivity. Yeah. So as a parent, you just got to make this decision. Nobody can make it for you. The pro-circumcision people, the anti-circumcision people, you just have to look and one of the things that also happened in the last 3 years was if you did your own research on something, you were considered a kook. Isn't that what we're supposed to do?
Yes.
We want to be
your own advocate.
Intellectual. We want to research things and understand stuff, but to be told that you can't do that is anti-intellectual, and I don't understand that. So I guess if you say, well, people are too dumb to understand it and they can be easily misled, well, let them look at the peer-reviewed stuff. Our audience can read a peer-reviewed study and they understand it.
Yes.
The ones that have listened to us for a long time. So, and they understand the difference between relative risk and absolute risk and the number needed to treat and all those kinds of things. So they understand that stuff. So you could do your own research. So go look at it. Do decide. And if you want to leave it till the kid is 18, they do have ways that they can circumcise adults now that really aren't as horrendous as they were in the past. Sam Roberts was on the couch for 2 weeks. Our friend Jefferson the Shyster was playing basketball or baseball the next day.
Softball the next day.
Yeah.
Very next day, yep.
Yep, and he even pulled his schlong out and showed us the sutures and stuff. Looked pretty, it was pretty meaty.
Pretty, yeah.
Meaty and veiny. It wasn't bad. I miss old Jefferson. We got to get him back on here. Anyway, so there you go. Interesting. The problem is you just have to understand the kid cannot give consent, nor would they assent to it. When we have pediatric patients, we often ask them for their assent. In other words, would you be okay if we did this? Mm-hmm. But if they're minors, by law, only their parents or a guardian can consent for them until they turn 18. And it was weird when my kids turned 18. All of a sudden, I couldn't refill their medications anymore with our app. They just dropped off the app. I had to go back, create an account for them, and then they would allow me to manage their medication on my app. So there's a lot of pain in the ass when your kids turn 18. They can just come and go as they please. They don't give a shit.
They want to know it. They just show up for money. Dirty clothes.
Yeah. The youngest girlfriend is named Sam, and he's always at her house. Mm-hmm. I'm sure they're just playing video games.
Of course.
But we always call it that, say that Beck's at Sam's Club.
Oh, boy.
You got any questions from the fluid family there, Dr. Scott?
Not yet.
If you don't, that's okay. Anybody have one that you did and Scott missed it, that's okay. Just go ahead and put it in there now. And if you don't know what we're talking about, when we record, usually around 1 o'clock on Saturday Eastern time, we are on YouTube, and you can join in and ask questions and stuff like that. And like I said, in the future, we're going to be doing a live stream where you can click on a link and actually be on the show and ask the question. If you don't want your face seen, you can use a puppet or you can just blank out your camera. That's totally fine, but you can ask questions live. We go back to doing that. I think it's going to be fun.
Cool.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This is what you do when you've just found that statement handbag on eBay and you want to build an entire wardrobe around it. You start selling to keep buying. Yep, on eBay. Over that all-black everything phase? List it and buy all the color. Feeling more vintage than ever? It's out with the new and in with the pre-loved. Next thing you know, you've refreshed your wardrobe basically without spending a dime. Yeah, eBay, the place to buy and sell new, pre-loved, vintage, and rare fashion.
This episode is brought to you by Pillsbury Toaster Strudel. Make every morning a memory with Toaster Strudel, a fun, convenient, and sweet part of breakfast. Made with sweet filling, creamy icing, and flaky crust, and prepared in minutes in the toaster, oven, or an air fryer. They're the perfect answer to your on-the-go breakfast needs. Mornings are better together with Toaster Strudel. Pick up Toaster Strudel on your next shopping trip.
This podcast is supported by Progressive, a leader in RV insurance. RVs are for sharing adventures with family, friends, and even your pets. So if you bring your cats and dogs along for the ride, you'll want Progressive RV insurance. They protect your cats and dogs like family by offering up to $1,000 in optional coverage for vet bills in case of an RV accident, making it a great companion for the responsible pet owner who loves to travel. See Progressive's other benefits and more when you quote RV insurance at Progressive.com today. Progressive Casualty Insurance Company and Affiliates. Pet injury is an additional coverage and subject to policy terms.
This episode is brought to you by PNC Bank, who believes some things in life should be boring, like banking, because boring is steady, pragmatic, responsible. You don't want your bank to be cool or sexy. Sexy is for red carpets, not banks. That's why PNC Bank strives to be boring with your money, so you can be happily fulfilled with your life. PNC Bank, brilliantly boring since 1865. Brilliantly boring since 1865 is a service mark of the PNC Financial Services Group, Inc., PNC Bank, National Association, member FDIC.
All right, and I wish Tacie were here for this. Never thought I'd say that. No, I'm just kidding. Just kidding.
And again, usually I call you with questions about my nuts or farting, but today I actually have a more serious question that's concerning my wife. She, for almost probably 8 months, has had these bouts of vomiting where if she's brushing her teeth and then she bends over to spit out the toothpaste, she'll get sick. And just lately it's felt like she said it's almost right where that xiphoid process is in your sternum. There's this pressure, and then she'll just cough up acid or bile or just mucus. There's nothing in it. So I'm thinking it might be like a hiatal hernia or maybe the early onsets of GERD or something like that. But do you think seeing a GI doctor would be the best thing? I mean, she's, a tough girl from the Bronx. Like, no, it's fine, everything's fine. But I'm trying to convince her to, check out which doctor might be appropriate.
Yeah, no, the reason I wish Tacie were here is because she does this every day. Mm-hmm. She pukes every single day when she's brushing her teeth. I hear her in there. And if she's brushing her teeth, I can't speak to her. If I say something, she won't answer me. If I say it again, she'll yell, "I'm brushing my teeth." It's just a nightmare for her. And 10 to 15% of people have this hypersensitive gag reflex. Mm-hmm. And that doesn't only gag when they're brushing their teeth, but sometimes when they need to take a pill or eating like mashed potatoes or bananas, not always. Some people just when they're brushing their teeth. And so some people will just try to brush the front teeth, and that doesn't seem to work. So I found a dentist that actually has some advice for people. And they say just getting your mind off what you're doing so you can properly brush and get your teeth clean. You could try just walking around the home, which is hard to do because there's always that toothbrush foam coming out of your mouth. But you can watch television while you're brushing. Switching from a manual toothbrush to an electric toothbrush could help. Didn't for her. I got her one with a little tiny thin rod on it, where the vibrating, the sonicating toothbrush is. Even that does it. Spit out excess saliva that builds up more frequently. And you can even read while you're brushing and see if that helps. And then they also recommend looking for a smaller brush head or even go down to a child-sized toothbrush. And the thing that I like is these water pick things now that you can walk around with. it's not attached to a machine anymore. It's handheld. And I have a couple of those. I think Philips makes one, and there are other ones out there. You just fill up the reservoir, and then you can floss with that thing, and it's pretty good. I've flossed before with the regular flosser and brushed my teeth, and if I ate something like nuts or something like that, I would use the water flosser, and all of a sudden you see all this other shit coming out of your mouth that's in there. So anyway, but trying to distract yourself, breathing through your nose and not your open mouth, you can try those kinds of things. That's easier said than done sometimes. And but if that doesn't work, and the acid that's coming up is coming from the stomach, so she may have hiatal hernia or a loose lower esophageal stricture. And she, if she's bringing up acid during brushing her teeth, she's probably doing it other times as well. So yes, a gastroenterologist would be good to see. Let them look down there, make sure everything's kosher. Sometimes they can close up that lower esophageal sphincter. There are even medications that you can take for that, like metoclopramide, that can increase the tone of the lower esophageal sphincter.
Yeah, I was going to say, I would hope there'd be a lot more things before a surgical intervention, but
you don't have to just scope it and see.
Right.
And then,
and before the what's the surgery? The
fundoplication.
Fundoplication.
Yeah, so they could do that. A fundoplication is for people who have severe mechanical reflux, and basically what they do is they take a piece of the stomach and wrap it around,
tie it off
the bottom of the esophagus, and just to add a little bit more narrowing there, make it more difficult for acid to work its way up into the esophagus.
Sounds like she's got the gag reflex and the really irritated esophagus too.
Yep.
So she's probably got hyperreactive airway too, with all vomiting that stuff up. So she may have to take, like you said, go to the GI doc just to make sure nothing goofy.
Yeah,
but maybe some sort of a antacid in addition to some anti-gag reflex kind of stuff.
Yeah,
and there's actually a little acupuncture point on the front of the ear you can press on.
Really?
That will help with the gag reflex.
Where is it?
We'll do it for them. It's on the front of the ear. It's on the outside of the ear. If you go like just up above, if you can imagine a hearing aid coming down the loop, or the wire coming down on the front, it would be right underneath there. So it's actually on the exterior.
Okay,
but it'll stimulate kind of the vagus nerve
on the top part of the ear, above the canal, but just in front of where the ear attaches.
Yep.
On the top, on the front.
Yeah, it's almost like if you could take the inner curve here, the I guess for like a better word, of spine, and you could kind of follow that to the outer part of the ear, kind of. Yeah. But it's right there. But you can massage that, and that's possible for gag reflex.
Well, hell, try
we'll
that.
do it for dental.
Hell, try everything.
For people going dentist that gag, we'll put those little needles in there before they go, and they can press on them. Yeah.
And it'll last through the procedure?
Oh, yeah. Shoot you.
Get the fuck out of here.
Oh, yeah, if you put it in there hard enough.
Okay. All right. Very interesting.
Oh, yeah.
All right. Let's see.
So good luck, dude.
Yeah.
Hey, Dr. Steve.
Hey.
It's Marcus from North Carolina.
Hey, Marcus. Long time.
Down here in Louisiana, messing up this hurricane, and I got pretty fucked up on Bourbon Street. Went back to my hotel room and used my penis pump and slapped the cock ring on and used my purple-headed monster.
Yeah.
Problem I have is I fell asleep with that cock ring on, and my dick kind of sloughed off.
Get that.
Wondering if we might have mastered that dick transplant yet. Yeah. Could you give me a little info on that?
Well, he's being hilarious, but that is an issue. He had a little whiskey dick, and he put on a cock ring, which basically restricts outflow.
Mm-hmm.
Blood can get in, but can't get back out.
Mm-hmm. Kind of tourniqueted it, didn't he?
Exactly. And then the scenario is he fell asleep with the cock ring on.
Terrible idea.
And then his penis sloughed off.
That's even worse.
Now, I know that didn't actually happen.
Right.
But these things sometimes do happen in places like nursing facilities and things like that, or other places where, let's say, someone retracts someone's foreskin to clean it, and then they forget to unretract it.
Oh, gosh.
And then the head of the penis falls off.
Oh. I think any part of the penis falling off is bad.
Yeah. No, agreed. Unless it's a big genital wart, then they can fall off all they want. But yeah, you don't want traumatic balanitis where your penis, the head of your penis sloughs off. And likewise, if you have enough loss of blood supply, let's say you're wearing a too small cock ring because you think the tighter the better. Well, by the way, hurts like an MF or so. Most people will not fall asleep with one. But what if you can't get it off? Because the penis is swollen on the distal side of, the side on the other side of the cock ring.
Sure.
And now it's difficult to get off. Cut it off. If you can't cut it off, go to the emergency room.
Not your penis.
No. Correct.
Of course. To be clear.
Give thyself a bell.
Finally.
Yes. Don't cut off your penis. Cut off the cock ring.
Cut the cock ring first.
Yes.
That makes more sense.
But so many of the cock rings now are really just to allow a vibrator to be stuck to the top of the thing, and they don't actually restrict blood flow. They just allow you to position this vibrator thing in the right place so that when you're fully inserted, the vibrator vibrates certain tingly parts. So anyway, I don't see a lot of people using the cock ring so much for erectile dysfunction anymore with the advent of things like sildenafil and the PDE5 inhibitors and alprostadil. But cock rings are still used, or venous outflow restrictors, penile venous outflow restrictors, are still used when you use a vacuum pump.
Right.
So the vacuum pump, you put the thing on, and there's a cock ring on the end of it, and you slide it over your penis. You evacuate the air. Blood flows into the penis because of the negative pressure. And then you slip the thing off. You slip the cock ring off to keep it that way, and then you can take the pump away. And that's how that works. So those are still used. And, it's not the most fun way to get an erection and try to have intercourse with somebody. Here's a question for Dr. Scott.
Oh.
Yep. I've been saving
Hey,
it.
folks.
Hey.
Got a question for that little hippy-dippy guy that used to throw a baseball around every once in a while.
Well, that could be me, too.
I keep hearing these stories and seeing things about being grounded. Not just being level, but actually taking your shoes off and walking in the grass to try to get your chi or whatever more in balance. I don't understand a lot of these things, but I do remember back as a kid, after you mowed the grass, take your shoes off, and how great that felt. It just brings back happy, warm feelings, just walking barefoot or walking in a creek, things such as that. Is there any scientific evidence to kind of show that might be a little healthy way of balancing yourself? Thank you. Ta-ta, Tacie.
Not here, sorry. What do you think?
I think so. I think there's a lot to be said about grounding and walking on certain surfaces.
Yeah.
And I think there's probably even more to it than just that. I think your relativeness to the to sea level is going to influence it too. Different electric fields.
Okay. Now you're going to introduce electric fields.
Yeah, a thing called gravity, maybe.
Gravity is not an electric field.
It's a power in the center of the Earth that pulls you to the center of the Earth.
Oh, no.
Oh,
that's
hell
not
yes.
What it does.
That is, yes. Gravity
is
rocks fall
curvature of space around a massive object.
But it makes a fucking apple fall from a tree onto the ground.
That is true.
Okay, so at least I got that going for me. But no, I think
it makes clocks run slower, closer to the gravitational source.
And
too.
It makes curveballs flat if you're pitching in Colorado's Rocky Stadium.
That's interesting.
Sure does. Yeah, honestly, pitchers hate to pitch in Colorado because anytime you hit a ball, it goes a little further.
Because the air is thinner.
Well, the air is thinner, but why is the air thinner? Energetic fields.
Oh, for fuck's sake.
Yes,
no.
sure.
Oh,
Yes,
my
sir.
God. No,
Energetic
that's-
fields. Yes,
No.
yes, it is.
No, it's not.
And plus, when a curveball, when the ball is spinning, it doesn't grab and doesn't curve as much
because
the
the air is
fields.
thinner.
Because they're further away from gravity.
No, it is interesting, though.
Oh, I'll bet you $1. I'll look it up.
I'll bet you more than that.
Well, the air is thinner. I agree with that. But also the gravitational pull does make a difference.
Oh, it is different. That's right. You're farther from the center of mass.
Well, that's what I said.
Okay, I got it. I think that effect is negligible compared to the difference in air density. But it is interesting, though. Whatever it is, it's a very small difference going up a mile from sea level.
Right.
But only a mile.
Yeah.
And if you could shrink the Earth down to the size of a cue ball, it would be smoother than a cue ball. It seems weird, but it's actually true. And so just going up just a mile, that elite athletes can tell the difference.
Yeah,
that's the interesting thing to me.
Yeah.
Now I was up 11,000 feet at Snowbird, and there was this woman that was very cute and very engaging. She's like, tee-hee-hee, let's go up and go skiing with me. And it's like, oh yeah, I'll go skiing with you.
Sucker.
So I go up there, and then she just goes, see you at the bottom, and she takes off. Now I was a decent skier in Michigan.
Oh my God!
I mean, I raced in Michigan. I wasn't used to powder at all. We never had that, and I got stuck in like 4 feet. Well, it must have been like 3 feet, but 3 feet. I was up to my waist and a little bit more in powder, not moving. And I said, I'm just going to die. Because I was at 11,000 feet.
Couldn't breathe.
Having difficulty breathing. Yeah. And what I did, though, was I just laid down on the snow and rolled up so I got kind of on top of it, and then just sort of scooted down till I got to part of the mountain where I could actually ski. But I really thought for a minute there, this is it. I can't move.
It's a terrible feeling.
It is. It was weird, too, when you'd get out of the shower, you barely had to dry off because the water can't stay on your skin. It's just so volatile at those altitudes.
Yeah, I don't do heights. I get really sick.
Do you?
Oh my god.
There's medication you can take.
Yeah, there is, but
acetazolamide, my friend.
But so going back to the most important question,
the barefoot thing.
Yes, walking. So
I think it's just primal.
We did this in school, and I'm probably going to way misspeak, but in Ayurvedic medicine, walking barefoot was like, grounding. They called it earthing or something.
Yeah, that's what you're talking about.
Same thing.
Just feeling the energies of the earth through your feet.
Well, I like to, and what Tacie was, I think, talking about to the chi. What I like to do is teach people, especially with balance issues, foot issues, and even a lot of stress issues, teach them what we call qigong walking, where you just walk really slowly, short steps, and you practice, the art of being kind of really aware of each step and where you are. You breathe in, you smile.
Yeah.
You breathe out.
I think it's just, it's meditative in that way. Sure. And it is the way that our ancestors ambulated on their feet. We evolved in a situation where we were walking on our feet.
Qigong, Qigong, Qigong walking.
So, and the Ayurvedics have, the 3 doshas, Vata, Pitta, and Kapha, and all that kind of stuff. So, if you were Kapha, that's water and earth. So maybe that's where those people would do better. But, who knows?
Yeah, I think it's important.
It's very interesting.
I think it's important,
Yeah. I'm just looking forward to Avatar: The Last Airbender, so there you go. He must be Vata because that's space and air.
Yep.
All right.
You want the one from, do we have time for?
Yes, of course.
Yeah, well, let's do.
Well, we have actually, we have time. Go ahead.
Well, I'll make a quick question. After a month on high-dose antihistamines, my doctor still thinks the on and off eye swelling is allergies, and then there's a clarification. It's under her. Sorry, my screen just skipped. Okay, swelling is under her eyes and on the edges of the eye, and can extend through face, sometimes with strange red line across face. That doesn't sound like it's an allergy to me.
Well, you can have a thing called periorbital edema. And they get puffy eyes, and it's periorbital edema. It means around the eye swelling. And, antihistamines will sometimes help, but I would, if that really looks like an allergy, I'd try steroids for a little bit.
Something a little stronger than that.
Yeah, give you a little steroid dose pack. If it goes away and then it comes back, then it probably is some sort of allergy, and I would send you to an immunologist and see what in the shit you're allergic to. Now, they say, using cold compresses, cutting down salt intake, blah, 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 but corticosteroids are the go-to. Now, you got to make sure it's not periorbital cellulitis. Now, periorbital cellulitis, different thing, it's an emergency, but you would know that. It doesn't come and go. Periorbital cellulitis is an infection of the tissue around the eye, and you can lose your eyesight with that, but it'll always be painful, angry, red, and it will look like it's infected, not just puffy like an inflammation from an allergy.
I wish she'd send us a little picture of her, the red line on her face.
Yeah, they'll use
clarification,
adrenaline sometimes in the emergency room if they come in. They'll give them epinephrine, just like DNP Carissa would take when she had her anaphylaxis, which we talked about several times ago. DNP Carissa, what would some of the other things that could possibly be going on with this person, do you think?
Maybe it's lupus.
Yeah, it could be an autoimmune disorder of some sort. It is certainly an immune disorder if they feel that it's an allergy.
Right.
Yeah.
But
just puffiness under the eyes, though, and then the red. Where's the red quote line?
Yeah, that's the thing. So people with lupus often will have a thing called a malar rash, which is over the cheekbones. They'll have redness there. It looks sort of like a mask.
Yep, butterfly kind of.
Yeah, kind of a butterfly.
Gotcha.
But you do blood tests for that. So listen, if they've had you on high dose steroids for a long time,
antihistamines, what they had.
I'm sorry.
Yeah.
Sorry.
I'm sorry. Yeah. Not
thank you
steroids,
for
but
correcting me.
antihistamines.
No, you get I'll give you a bell for correcting.
Give thyself a bell.
I didn't want to say the wrong thing. High dose antihistamines, and it's still there, then this bears further investigation.
Right on.
That's basically what we're saying.
Yeah, maybe even ophthalmologists, possibly.
Maybe. Yeah. Ophthalmologists deal with this stuff too. They have to. This one is one of those multidisciplinary things. It could be a bunch of different places. All right. Well, hey, thanks to Dr. Scott. Thanks, DNP Carissa. Thanks to everyone who's made the show happen over the years. Listen to our SiriusXM show on this Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. And many thanks to our listeners, particularly those in the Fluid family, including Lovett, Sean P., and who else? Oh, Stacy DeLoach is in there. Hello, Stacy.
DP's in there today.
Yeah, there you go.
Amanda.
Do a whole and Amanda
Sweet
Davidson.
Amanda.
Yes, thank you for your continued support. I want to do the whole Cardiff Electric roll call. Although when we do our live stream, we will, because that's become a thing. And I'm hoping Marco P193 or whoever that person is shows up, and Kinky Loco, of course. But check out our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank God.